Burnout Recovery for You with today's talking about Burnout Weekly Video Tip. And this week we're going to talk about EMR tips to help you help your patient and get the patient to love you and not your EMR. And also, surprisingly, these are also tips that help with your burnout as well. So I will just jump right into it. Tip number one, if it's humanly possible, look at the patient when you're talking to them. I know we're all on a lot of time pressure. We have to look at the computer to get data from them. We have to look at the computer to enter data, okay? There are lots of ways to avoid those little scenarios, which, if nothing else, make the patient feel like they don't even need to be in the room. They could do this on a phone call, which obviously we've been doing a lot of video calls during COVID, but what I would please tell you to do is either have someone in the room to do the data entry for you so you can devote your time and attention to the patient, because I think you'll pick up more information from them as well, and you'll be more in the moment and present with them and providing better care. Number one. Number two, the patient will actually like you and feel like that you care about them and will do what you're asking them to do from a compliance standpoint. And number three, I think it's relaxing, and it's a way for you to connect with the patient, decreasing your burnout. Okay, so that's tip number one, is please don't look at the computer. Tip number two is what we do. We don't even have any computers in the rooms. We review the chart electronically before we walk in. We have any relevant information that we need to give the patient with us in paper form, and we walk in with a little piece of paper and have a discussion and conversation with the patient. I like that because it frees me up from carrying a device around, and it also is a great way to give the patient 100% of your attention when you're with them. So that's tip number two. Tip number three is really, this is more not EMR tips per se, but this is just general tips. When you walk in the room, knock first, then walk in smiling. Introduce yourself if this is the first time you're meeting the person. Introduce yourself to the family members if there are family members with them, and then smile. And in a time not of a pandemic, you would shake hands. Okay. At this point, we bump elbows and do other things, which after 25 years of practice, it's a little disconcerting to me, but that's what we do. So, build rapport. If the next step, I would say, in this introduction process to the patient is to compliment them, give them an honest, sincere compliment on maybe something they may be wearing, or the fact that maybe they have a new cast, and ask them perhaps if they've been doing too much kung fu. A lot of times I think getting someone to laugh will be helpful to relax them, because most people don't like coming to see us unless they want to come and see us. So those are probably the biggest tips to just help build rapport and get patients to interact with you. I feel like the more you build rapport with the patient, the better they will exchange information with you, the more compliant they will be going forward. So help your EMR not run you. You run the EMR, be in charge of that. But most importantly, be in charge of your interaction with the patient. And most importantly out of that, let that interaction become the real crux of why you're there. And learn what you can. Ask them about their any personal hobbies or interests, and let that feed your soul as well. Because the more interaction you have with those patients who you're fortunate enough to see, the better you will feel, and the less burned out you will have, and the more connected you will become to your purpose and this thing that we call medicine, that most of us see as a calling. If you like this video, please head on over to our YouTube channel or our Facebook page and sign up. Jeff Moody MD is for Facebook, and you can head on over to our live streaming channel and our video channel on YouTube, Jeff Moody MD. Also, head on over to the website, jeffmoodymd.com or jeffmoody.com, to check out my book, The Doctor's Burned Out, A Physician's Guide to Recovery, as well as my online course, The Burnout Recovery is for You, and as well as our speaking and consulting services. We want to provide you the resources to recover from burnout. Until the next video, remember, burnout recovery is for you.